Hey, hooray! You got the gastric sleeve. But here are 5 reasons that it might fail. Hi, I'm Dr. Seun Sowemimo, here to talk to you today about 5 reasons the gastric sleeve might fail. Obviously, people get the surgery to lose weight, but it's not a magical pill, and understanding the reasons why it might fail would help you to make sure that you're a success. So here we go. Number 1 is lack of understanding of how the sleeve actually works. I believe if you understand how the surgery works and what it does, that would help you to know its limitations and what you need to do to make sure that it works the best for you. So the surgery will do 2 things for you. Number 1 is that the surgery is going to give you restriction. Usually it restricts people to about 2 to 4 ounces of food in the beginning, solid food, and then somewhere between 4 and 6 ounces the further out that you get. So that's one thing, the restriction. And everybody, of course, thinks that this is the main way the surgery works. I don't really think so. Second thing that it gives you is a metabolic kick because it touches many points along which your body controls your weight. This lasts about 2 years, or else people will just keep on losing weight forever. It lasts about 2 years and it's hottest actually in the first 6 months. So you have to take advantage of that first 6 months because that's when we see the most rapid rate of weight loss. The third part of the surgery is really what is up to you in terms of lifestyle change, which comprises mainly of a dietary change, eating the right diet, and exercise. So let's go to the second thing that might cause a gastric sleeve to fail. And that is eating the wrong things. If you're eating calorie-dense meals and slushing down milkshakes and Slurpees, you may not see significant weight loss. And at the end of the day, you might actually see some weight regain. So I tell my patients, you got to make sure you're eating the right things that are not calorie dense. With the gastric sleeve, there's also something called a dumping syndrome. We see this to a greater effect in the gastric bypass, but some of my patients with the sleeve also report that they have some sort of dumping. Now, dumping syndrome is something that helps to put a check on you. So I don't think it's all bad. But the long and short of it is that when calorie-rich nutrients reach your small intestine at a quicker rate than they're used to, you get a lot of blood rushing into the system there. People feel lightheaded, they feel faint, they don't feel well, they may have some diarrhea, nausea, vomiting. It's a bad experience, but then it's also a good teacher not to eat things that are very rich or calorie dense. Number 3 is lack of exercise. You know, I saw in a tweet, or was it an article, not too long ago by Sanjay Gupta, that exercise may not be so beneficial to losing weight. Bad boy, Sanjay, bad boy. I love the guy, but I gotta call him out. Exercise is key in terms of losing weight because it helps drive your metabolism up. It helps to keep the engine of the body working very well and more efficiently in terms of burning calories. Now, we have a sedentary lifestyle to start with. Most people wake up in the morning, sit down in a car, going to work, even though they might be driving 70 miles an hour, but they're really just sitting down there. They get to work, they sit down at a desk. Most people have a desk job. And then they come back from work, they go to the couch immediately, they lay down on the couch and they're flipping the remote control, not even getting up to walk to the TV to change the channel. They finally fall asleep on the couch, drooling out the mouth or something, and then they go to sleep. And they wake up again and repeat. Drive to work, sit at work, on the couch, back to sleep. So we have a sedentary lifestyle. So we need to get moving, we need exercise. This will help drive the weight loss after a gastric sleeve. And then Fourth thing is medications. Medications are so common nowadays. We take a pill to sleep, we take a pill to wake up, but the thing is that a lot of these medications have side effects, and some of those side effects is weight gain. Even some common medications like beta blockers can cause weight gain or are weight positive. But the really bad players amongst medications are things like steroids, are things like major depressants. So if you've had your gastric sleeves, you want to make sure that you avoid these kinds of medication. If you have to be on some medication, have your physician check out that those medications you're on are not weight positive. And if they are, if you can be switched to another kind of medication in that same category, giving you the same effect, but it's not weight positive. And that brings me to my final reason why a gastric sleeve may fail. And I hate to admit this, but it's for technical reasons. Normally when we do a gastric sleeve, we size the amount of stomach we're leaving behind. That's number one. Usually we use a tube that is about the size of a garden hose, and this guides the amount of stomach that we leave behind. Now, it's easier to make a bigger stomach because in doing so, there may be less complications, especially in cases where the patient has actually had another kind of stomach surgery before. So some people, and I've seen this in some cases, maybe after they've had a band and have switched to a sleeve, the surgeon leaves a lot of stomach behind, especially around the fundus. And this may contribute to the failure of the procedure because especially that part of stomach around the fundus is the part that produces a hormone called ghrelin. Ghrelin is the hunger hormone. And part of how a sleeve works is taking out this portion of the stomach that produces the ghrelin. In fact, one of my patients, the very first thing he said to me when I spoke to him in the recovery after the surgery was, "Hey doc, did you take out the gremlins?" So it's very important that the surgery is performed technically well. Here you have it. Those are 5 reasons that a gastric sleeve might fail. Thanks for watching. Please subscribe to our channel if you got some useful information out of this, and feel free to share this. Let's see your comments down below. I'll be sure to respond. It's your friendly bariatric surgeon, Dr. Seun Sowemimo. I'll see you next time.